Inder Singh. You're the founder and CEO of Kinsa, but rather than introduce you further, now that we've seen you, let's play a quick video.
They say that knowledge is power. Never has that been more true than with the COVID-19 crisis. Early knowledge on where and when illness is spreading gives us the power to stop it, keeping our country and economy safe and protecting our way of life. Kinsa has built an early warning system to track and stop the spread of illness. With more than 2 million smart thermometers in use across the country today, our system detected COVID-19 spread nearly 3 weeks before case numbers surged. With this early information on where illness is starting and spreading, our leaders can make informed decisions on how best to keep our communities safe, healthy, and prosperous. Since fever is so often the first sign of a contagious illness like COVID, the more Americans using Kinsa thermometers, the more precise our early warning system can be. Our homes, our schools, and our workplaces are the foundations of our society. These are also the places where illness spreads fast, so we focus our efforts here. While completely protecting individual privacy, Kinsa gives your community the knowledge needed to stop the spread. With more information on what's going around, schools and workplaces can take actions like increased disinfecting, testing, or use of protective gear. And this same information gives you the knowledge to make the right decisions for your family. If you're healthy but may have been exposed at work or school, Kinsa guides you to the right actions to stay well. If you or a loved one is sick, Kinsa helps you detect and respond to your illness. By using Kinsa, you help yourself and your family get better faster. You help your community stop the spread of illness. And you help your healthcare system, your state, and your country contain outbreaks early. Because knowledge is power.
Super good. Nice, very good explanatory video, Inder. I think it's even improved from the last time I saw it. I think you've really done a good job of that. But you have more than 2 million thermometers out there now too, don't you?
We do. It's been wonderful to see the adoption of the system by consumers and the support of the system. Really, that's our core asset. It's a group of 2 million households across the country who use our products and trust us to make use of that data for public health. And we're grateful for the support of all our users out there.
Yeah, and we call this session crowdsourcing for public health or something like that. And just finish introducing you. You came out of the global public health community, where you were the EVP of the Clinton Health Access Initiative. You've done a lot of work in the nonprofit sector globally. But the insights you took from that, you brought to Kinsa. But why don't you just quickly describe what was the insight that led to creating this company, and how do you describe the company at the macro level?
Yeah, let me start by posing the question that I posed 9 years ago. Boy, 9 years working on this mission. 9 years ago to start the company. How do you stop the next outbreak before it becomes an epidemic, or God forbid, a pandemic, if you don't know where and when it's starting? And the answer, as we all know very personally today, you don't. Hence COVID, hence the concerns about Zika, Ebola, hence HIV in the beginning. Hence, this is how outbreaks become epidemics and pandemics. If we know where and when it's starting, we perhaps have a chance to contain it, to send the test kits, to send the virologists in, to characterize it, to contain it, and to fight it, and to prevent the next epidemic. And that's really where we started the company. In my last job, I got really familiar with the way the world tries to curb infectious disease. I had the great privilege of working alongside the World Health Organization, the UK's Foreign Aid Agency, DFID, the Gates Foundation. And the sad fact was that the way we as a society allocate money to curb infectious disease is with zero information about where and when it's starting. And that's what we set out to do. We said, can we use technology to get 3 data sets? There were 3 data sets that we sought to get from day one to be able to identify an outbreak, predict it, and identify whether it's unusual, whether it's something that you'd expect that's endemic, like seasonal flu, or something that's unusual. And that's how, fast forward today, we've got that kind of data coming in, real-time data on where and when symptoms are starting from people in their homes. how fast it's spreading, transmission, and how long lasting and bad it's getting. Like how long is the illness? What are the symptom? What's the symptom severity? None of this is rocket science, but the reason why we can't do it today is because our healthcare system, it's too late by the time someone enters the healthcare system. It's too late to stop the spread of an illness. And let's play that out. Right? Person one in the household maybe has mild fleeting symptoms. They go away. You never go see the doctor. You never go and get a lab test. Person two in the household is asymptomatic. Now, this is true not just of COVID-19. This is true of flu, of cold. Some people who contract it are asymptomatic, but they're still spreaders, right? Person three gets it after an incubation period. They get symptoms. And then, according to the latest data I saw on COVID-19, 5 to 8 days later, they get sick enough to enter the healthcare system. By that time, it's too late. And so we wanted to go to like the inception point. When someone in the household is feeling unwell, can we start a conversation with them? And our app and thermometer are the secret sauce that allow us to do that and get that data. And that's kind of how the whole system works. Oh, you're on mute, David.
Sorry. One of the tragedies is that you actually saw COVID coming and nobody believed you, basically, right?
Yeah, on March 14th, we did an analysis where we looked at the data. And what we did was we looked at the real-time data and subtracted out what we would have ordinarily expected from cold and flu season. We subtracted out on fever incidents, we subtracted out on transmission. And what we saw was this unusual rise in illness across the United States, in New York City, throughout the Northeast, in Florida. At that time, there were just first cases in King County and Santa Clara County. So we got on a call with the former New York State Health Commissioner, who's an advisor, Dr. Nirav Shah. He called a former head of the FDA. He called a former a dean of a public health school. It was a Saturday night. We're on this call with all the scientists saying, what we're seeing is an unusual outbreak across the country. It's a black swan event in so many different parts of the country. And they looked at it, and our scientists talked to it, and external scientists talked to it. But the conclusion was, Inder, this isn't credible. We're not seeing case reports in other parts of the country. Go do your homework. 3 days later, we came back and we said, we've done our homework. We believe it's a moral imperative. And on March 18th, we launched healthweather.us to show hotspots. A number of public health researchers and cities and states looked at the data. And what we picked up was COVID-19's community spread 3 to 4 weeks before cases were starting to be accumulated and case surges were starting to occur. It was pretty amazing. We were too small to be taken seriously at the time. There was a lot of research done on it. But I think we've shown that this kind of early warning system is possible. You can take granular biometric data and truly turn it into an early warning system for infectious diseases. And that's the first step in containing.
Yeah. The thing about your system that's so impressive to me is that it is a national and could ultimately be a global public health intervention system, but it also works for the individual. So, you've made a smartphone app connected to a thermometer, and I actually have a sniffle today. So I thought, I'm interviewing Inder. I'll pull out my Kinsa thermometer and see if I have a fever, because I thought maybe I might even have one. I did, and it took me through, I actually was below normal, so I'm not sick, good. But it took me through some really useful questions that might be pertinent to what was happening to me. And so you don't just take someone's temperature, you take them through a analysis of their symptoms on the app, all of which creates data that you get and which you could use to feed information back to them for their benefit, as well as aggregate for the collective public health benefit. Was that well said?
Yeah,
well enough
absolutely.
said?
It starts with value to the user. Like, I will argue all day and all night that our thermometer is far more medically essential than any thermometer ever created, because it's not a thermometer, it's a triage system. It starts with a thermometer. And imagine, wouldn't it be really cool to have a business model where you gave it away for free, this medically essential triage system and product, and you made money because you're helping the system to decrease costs and save lives? That's the business model we created. So today, we give away thermometers for free to 5% of U.S. elementary schools. These are Title I underserved communities. This is one of the ways we're able to get into sentinel groups, the groups that are going to give you the earliest of early warning signals. The underserved communities, the uninsured communities, the larger multi-generational households where virus can sit as a reservoir only to create a community flare-up later. So that's how we've been getting into those communities. And we're giving it away for free through these school communities. Not only is the user getting the benefits, but the school gets an early warning system. The nurse and the principal get to see on a grade by grade level what the trend in illness is. And there's some automated AI tools that say, this is what you should do now, send this message out here. And then, of course, at a geo level, at a state or city level, you now have nuanced understanding of where the outbreak's occurring and can respond to it. That's the model we're trying to build out. We're fortunate that it's starting to take off, but we need to take that model global.
But you're financing those giveaways yourself typically? Are cities and states buying them from you? How's that working?
It's a little bit of both. We're really grateful for corporate sponsors prior to the pandemic. Lysol, Boiron, Lysol is a major sponsor of ours, sponsoring thousands of schools across the country to get that product out there. Now, cities and states are starting to embrace it. And part of that is through funding from the American Rescue Plan. A lot of the schools that had corporate sponsorship are asking us, how do we maintain this for the next 3 to 5 years? And they're starting to think about spending some of the significant money that's coming to school districts. Is like $110 billion coming down through the.
Oh, so this new bill could really benefit you.
It could.
Your project.
I would argue it benefits the school districts, but yes, it could, absolutely.
Of course, it's benefiting the school district, but I'm not saying it's not good to benefit you. So you did expand tremendously in 2020 because you got a lot of attention for having been right, even if you were ignored, and your thermometers had a lot of utility. So now you've got roughly double, I think, the number in the marketplace you did in the beginning of COVID. But I guess what I'd like to know is, is this indicative in your mind of a bigger picture trend in American public health? I mean, first of all, you've got to succeed. I know you're a startup, but does this kind of mentality apply more broadly? And do you see those in the health system beginning to respond to your company with a little glimmering of that?
There's no doubt in my mind that COVID-19 has accelerated telemedicine and telemedicine tools. Smart thermometers certainly fall into that category. Accelerated the adoption of those technologies. There's no doubt in my mind. The question is, will it continue, right? Will that trend continue thereafter? I hope it does, because I think this is the wave of the future. Listen, we need to start going to people when they have a change in health status, as opposed to asking people to come to the healthcare system. When we start doing that, we've taken healthcare to a new level. And these telemedicine tools and telemedicine itself holds that potential promise. The wearable products out there, the smart thermometers, but we need to make further progress because we're still missing those underserved communities. These products are still not designed for widespread use and widespread access.
Right.
Wearables are often still used for the fitness community, the wellness community, not the illness community, not the underserved. And we've got to really think carefully about how we want to incentivize technology to make sure that we're not just progressing it for the rich and the middle class, but also for those communities that have been left behind. Telemedicine holds that promise. We just need to sort of think carefully about how to do it. COVID-19's accelerated it, but the question really remains, does it continue? The other thing I'll say is, listen, the public health community, if I'm being really transparent about it, I come from that community. That community is 20, 30 years behind on technology, right?
Right.
I think the American Rescue Plan, provides a lot of funding for CDC to do data modernization, et cetera, but we've got to really be thoughtful about how to equip our public health institutions, our local public health institutions, with the funding, the knowledge, the incentives to really start thinking about the next generation. Had we done that earlier, I bet we would have been a lot better off with COVID-19. I think it's important that we not forget that.
It's interesting to think of your Kinsa thermometers as effectively an element of the Internet of Things and effectively a sensor, right? In a society that's moving towards ubiquitous sensors, you are deploying one really important one, but basically government doesn't get it yet, right? I know you would love to get the federal government to say, hey, yeah, let's give these away for free to every household, so then we can make sure we see the next pandemic before it gets out of control. And maybe that'll happen. And maybe some of the things that this new bill with the money, maybe a little bit of mutually reinforcing phenomena. But I mean, what am I asking? One of the things I want to ask, because we don't have tons more time, but I know you felt when I talked to you, the first was I think in December maybe, and one of the things you were saying back then was, once the vaccines are out, you will be able to find out whether they're really helping with public health. And vaccines are starting to be out now. Are you learning anything about where COVID is going based big question, where is COVID going now based on your data?
Here's a couple interesting anecdotes. We are seeing all-time low illness levels overall. So
Really?
COVID's high, but we had the lowest, flu incidence levels that we've seen in a long time.
What, for like the whole last year or just the last few months?
The last season was
Last season.
historically low illness levels.
Right,
In fact,
right.
there was a New York Times article that came out about 5 months ago where we were just showing our projections forward. And even though COVID was high, we didn't have the twindemic. I'm worried that there might be a twindemic this season for those that are not yet vaccinated, and because we're going to probably see a rebound effect on flu. So we won't see the kind of mortality in COVID, thankfully, but there might very well be a twindemic coming up here. We're still watching that very closely. We do expect that it's going to be a normal seasonal illness level coming up going forward. We're seeing this interesting phenomenon. A lot of the fevers that we've seen reported were vaccine related. We're asking people, did you get your vaccine recently when we get fever? A lot of the fevers we're seeing right now are vaccine related. So it's like
Right.
that day or two after you get the vaccine that you might have a slightly elevated temperature. That's interesting. So that's what we're seeing today. We've got to analyze the data a little more closely to really understand what's going to go on with COVID here. But that's kind of some of the anecdotes that we're seeing right now.
So it's too early for you to have data that would suggest whether the vaccines are significantly affecting global public health.
Yeah, exactly. We're not seeing, again, the fibers that we are seeing are often vaccine related. So that's a good sign, right? That we're not seeing general illness levels rebound very fast. So.
I know we've talked a lot about the United States, but you're a global person. Obviously, your long-term vision has got to be to get this kind of system deployed much more broadly than just the United States. What is the state of interest from around the world, and what would your ultimate ambition be?
I've always aspired to a global early warning and response system, one that can really reach the masses, and that's what we're going to go march toward. It's interesting at the beginning in the middle of the pandemic, we actually had a couple of foreign governments come to us and say, hey, we want to do national deployments. We weren't ready for that. We didn't have the infrastructure to facilitate that, but we're going to try and go back and look at that. It's interesting, let's be clear about this. There were certain countries that were more prepared for COVID-19. Countries like Singapore and countries in Southeast Asia, even the Nordic countries who had seen pandemics before, 2009 swine flu, 2003 SARS, which affected a lot of Asia Pacific. Those countries were a little more prepared. They shut down very fast. Those are the countries where we're seeing interest expressed in these kinds of solutions, partly because I think they're a little more wedded to we think in this way. We think about early warning systems. We're used to thinking this because we saw 2 or 3 pandemic situations over the last 20 years. And so, that's where we're getting some inbound inquiries, and we hope to be able to go faster towards those countries.
Really cool. And we thought that putting Kinsa and you in this conference was appropriate, because if we're about unity or coming together more, what you're really doing is bringing together people to put the public in public health effectively, which I really like. So
yeah,
congrats.
Let's talk about that for a second, David. Like, what we've created is a network of coordination and cooperation. That's really what we've created. People use our products, but the number 2 reason why they stay users is because they want their data to contribute to healthweather.us or to an early warning system. It's become one of the top reasons that they want to continue in the network. It is fully privacy protected. It takes their consideration. It takes into account their considerations, but it's really a network of coordination and cooperation. If you're going to solve any big problem in the world, you need a network of people who are willing to coordinate and cooperate, right? Whether that's climate change or whether that's public health. And in this country and in many countries, we've often approached public health in a very top-down way. This is what ought to happen. The experts say we also need to make sure that we're engaging with the everyday person, because they want to be a part of a solution. And this network, that's really what we've built, is a network of information, ease of use that helps you know what to do when, helps you understand what's going around your local community, helps you understand what's going around your child's school to prepare you, and then asks you to take certain actions that help yourself and help your community. It's that network. It's a bottoms up participatory network. And that to me is the first step in solving any big problem in the world, is that coalition of actors working together. And we've got that. And we want to layer on all sorts of things, partnerships with other companies, to make sure we can take public health to the next level. That's really the asset we've created and the goal of Kinsa.
But we want to stay in touch and keep supporting you and tracking your progress, and very exciting innovation. Congrats on the progress you've made, particularly in the last year. So thank you, Inder.
Thank you.
Thank you for joining us. Really good.